transmission in the household and trying to reduce the risk of secondary transmission at home, which has become a major factor in Europe and North America for transmission. Focusing on protecting yourself and protecting others, that individual education, individual knowledge transfer, and getting that clear and consistent messaging out. I think Europe this time round has done a much better job in having consistent processes across all of its. Let's look at the European Union. The member states of the European Union have aligned better on the types of measures. They've looked the same and how they've approached things much more. There's been a consistency in that messaging, and if you see the European Union as a sort of a federation of states, and you look at a very large country like Brazil or other large federated states, that ability to negotiate with and reach consensus with subnational entities and find consensus on how to move forward together so that populations get clear and consistent messaging, clear decisions on public health action, clear decision on mandates that are to be implemented by government. I think that's what we've seen. And we've also seen previously, for example, the Brazilian Health Service reacted wonderfully to the last surge in cases, and certainly so many brave frontline health workers in Brazil. But they were pushed to the very limits of their capacities, both in terms of equipment and their own fatigue, and therefore it's going to be very important if, as numbers increase, that they are protected, that the health system is protected from a large surge of cases. You cannot assume that a health system can take the same beating a second time round. And what we have seen too, as case fatality rates have dropped, and in every age group, and what we've seen is higher recovery rates for all age groups, and that's been over the summer, and that's been very much down to doctors and nurses having more time with patients, having more time to give clinical care. If we get back to a situation where intensive care units are overwhelmed, we will see the death rates rise again unnecessarily. So all of the things we've said before, what we need now is to do it quicker, to do it more consistently, in a more coordinated way, because we've learned what works. There is an excuse the first time around. We're all learning, we're all adapting, we're all testing what our populations will accept or won't accept. The second time around, you need to have done that learning and understand how to do better this time. I think countries in Europe have really tried to look at how they can improve what they are doing, and I think they have improved this time around. And hopefully there are lessons there and learnings there for countries who may now be entering a second surge or a second phase. Maria?
Yeah, I'd like to add to is even as case numbers are coming down, all countries need to remain vigilant. You've heard us say this before, but we really need to emphasize this again. Do not let your guard down. It is good to see the measures taking effect and transmission going down, but it is not time to let up. And it's time to even scale up. So in situations where you're bringing this under control, it is time to scale up your public health infrastructure still. Work on making sure that you have adequate workforce to do active case finding, to conduct those tests, to use those tests strategically, as you heard us say many times, and the Director General emphasize again today, to work to have your health systems be ready for any potential resurgence. That includes making sure you have ample hospital beds, ICU beds, supplies, PPE for your staff. It is still time to scale up. I know that sounds like it's probably doesn't make sense. If case numbers are going down, why do I need to scale up? It's just use the time appropriately to prepare and to revise. As Mike has said, we're learning, and so you can tailor your approach to be more agile. Community transmission. But what we don't want to see is situations where you're moving from a so-called lockdown state to bringing the virus under control to moving to a so-called lockdown state. And it's really important at that time when transmission is brought under control that we don't give up. We don't let our guard down.